This is an essential part of effective listening. The aim is to help patients to talk as fully as possible about their problems. You can help them verbally or non-verbally. It is sometimes necessary to ask a patient to clarify something they have said. This can be done in several ways. Please tell me exactly when your abdominal pain starts. Can you describe the pain in more detail? What do you mean by this needs? Reflecting back to patients what they have just said may help them to proceed with their story, particularly when they may find it difficult to go on because of their feelings. It is important to use your time as efficiently as possible. This may involve helping the patient not to stray from the main point of the interview. To do this, you should interrupt at an appropriate point and try to redirect the interview. For example, what you have just told me about your job is interesting, but I'd like to hear more about the headache you've been having. It would help me to know more about the circumstances that bring on your chest pain. At the end of a consultation, summarize what the patient has told you. For example, I'd like to make sure that I've understood you correctly. You told me that. Summarizing serves several important functions. It allows you to check the accuracy of the patient's story by providing the patient with an opportunity to correct any misunderstandings. It enables you to review the patient's story and deduce what else needs to be explored. And it allows you to buy time if you get stuck and cannot think of what to ask next. Summarizing what has been said so far may help the patient to carry on discussing the problem. It is one method of facilitation. It may help you to keep the patient on track. It can let the patient know that you have been listening carefully and are interested. It is an appropriate way to close an interview. Patients appreciate the interviewer who demonstrates empathy. Empathy means putting yourself in the other person's place. As Sir William Osler advised, realize as far as you can the mental state of the patient. Enter into his feelings. Scan gently his thoughts. The kindly words, the cheerful greeting, the sympathetic look. This, the patient understands. Some people can empathize more easily than others by virtue of their personality. However, there's evidence that the ability to empathize with a patient is a skill which can be learned. Demonstrating empathy involves many of skills we have discussed in the chapter, including maintaining good eye contact with the patient and adopting an appropriate posture and a tone of voice, listening attentively, picking up and responding to verbal and non-verbal cues from the patient, indicating that you understand what is happening to the patient. For example, if a patient tells you, "My father died from a heart attack 7 years ago while I was on holiday in France." As a doctor, you can choose to respond in this way. There must have been a distressing time for you. Remember that empathy is a powerful therapeutic tool. Include adopting an appropriate posture. For example, lean slightly forward toward the patient. Maintain eye contact and nod your head at appropriate times. Silent periods may make us feel uncomfortable, and there can be a temptation to rush in with another question. Try not to do this. Silence is valuable giving the patient time to reflect on what has been said. Use them yourself to observe the patient, to reflect on the interview so far, and to plan the next stage. It is important to leave sufficient time to end the interview properly. The essential features you should remember are: summarize what the patient has told you. Ask the patient to check the accuracy of what you have said. Ask the patient if you have left out any information that the patient feels is important. Inquire if the patient would like to add anything. And by thanking the patient, such as, "Thank you for talking to me, our time is now up." Okay, let's review the key points of Chapter 2. I compare the whole consultation process to a song. To achieve this process perfectly, we must make sure the parts are in harmony. Before entering the conversation, we should think about the format that you are going to choose for this interview: doctor-centered or patient-centered. And then, prelude, how to make a good start. We should think about the following important factors: setting, doctor-related factors, and patient-related factors. When we are ready, how do we begin an interview properly? We gave some advice to help a patient feel at ease. Next, the verse, refrain, and the interlude: questioning, listening, and facilitating. 3 types of questions that are often be used during a medical interview: open question, closed questions, and a probing question. And at the same time, we should pay attention to that complex questions and leading questions should be avoided. When we listen to a patient, the active listening is important. The key features of active listening as follow. Take it in your mind that their verbal and non-verbal cues should be picked up. In order to help patients to talk as fully as possible about their problems, we can help them verbally and non-verbally. Finally, it is important to leave sufficient time to end the interview properly. Well, that's all for Chapter 2. Thank you for your watching.